I'm excited to bring up my colleague, truly someone who understands that you can't lead the people if you don't love the people, Senator Tina Smith.
Well, good morning. I think it's still morning, everyone, and thank you so much, Senator Booker. And I want to also particularly thank the folks standing behind me who aren't from Washington, D.C., to tell us about what people are really talking about. And, you know, I think that for most Americans, healthcare isn't about politics. It's personal. Is your family healthy? Are your children healthy? Can you get in to see the doctors and the providers that you want? Can you afford to get the care that you need? And I think it is also true that most people in this country would agree that our healthcare system is broken. It takes too long to get what you need, it costs too much, and it might not even be there when you need it. And so this summer, when Donald Trump and Republicans passed their so-called One Big Beautiful Bill, what did they do? They made this worse, not better. They kicked millions of people off of their health insurance, and they made everything more expensive just when Americans are struggling to figure out how to afford their lives. And in fact, what they did do is they found trillions of dollars to give huge tax breaks to big corporations and billionaires. But what didn't they do? They couldn't find the money to extend the ACA tax credit so that people can afford their health insurance. Plenty of money to give huge tax breaks for billionaires, but not enough money to help regular people afford their health insurance. And now here we are. We're just a few days away from November 1st, where millions of Americans are going to see their health insurance premiums double or triple. And I can tell you, in Minnesota, this is what people are seeing and feeling. This is what it looks like for people in my home state. I have talked to providers in Minnesota who know they have patients, who need health care for chronic conditions, who are faced with either dropping their health insurance or somehow figuring out how to literally skip going to the grocery store so they can afford their premiums. I've talked to a young woman who works for a nonprofit child care provider, and she is going to drop her health insurance because she can't afford it. She doesn't have health insurance through her work. And what does this mean? It means she's going to postpone starting her own family. We are nearly 30 days into this shutdown, and Republicans and Donald Trump are keeping the federal government shut down rather than working with Democrats to try to figure out how to solve this problem. And I can tell you, Minnesotans are not happy about this. Farmers and ranchers, small businesses who rely on the health insurance exchange to buy their insurance, they are struggling to make a profit right now, and Donald Trump and Republicans are making it worse by raising the cost of their health insurance to levels that they cannot afford. And I can tell you it is particularly rubbing salt in their wounds to see that at the same time Trump is sending $20 billion to Argentina to bail out Argentina and to bail out the wealthy Wall Street fund managers who are going to benefit from this bailout, but he refuses to help people afford their health insurance. So let me just be clear. Republicans are refusing to negotiate with us. They just keep doing the same damn thing over and over again and demand that we vote for their so-called clean CR, but there is nothing clean about a CR that raises healthcare costs for people so exorbitantly. It's bad for America, it's bad for Minnesota, and I'm not going to help them do it. The best time to fix this was weeks ago, but the next best time is right now. And we can do better than say to America that you have two choices. One choice is skyrocketing health insurance premiums, or the other choice is decimating the nutrition programs that help people put groceries on the table. That is not a real choice. That is not the choice that I will accept. We can do better than that.